On behalf of World Sleep Day, which is today, I would like to emphasize the importance of sleep. Sleep has become extremely vital these days because sleep is basically charging your body to be active for the next day. So, what is a sleep hygiene? So, when I mean by sleep hygiene, it is about how hygienic we are in terms of your sleep. It's an interesting term, isn't it? So, sleep hygiene is nothing but how many hours do you sleep, how effectively you sleep, how you plan your sleep, and how to maintain the sleep is what sleep hygiene is all about. So, when I say sleep hygiene, ideally a person should have a quality sleep, which means 8 hours of sleep. So, there are a lot of people who say, I sleep for 8 hours. Sleeping 8 hours these days is just going to the bedroom at 10 o'clock, but you don't actually sleep. You're on the phone for a couple of hours, and then by the time you sleep, it's about 12, and then you have to wake up in the morning for your commitments. That's not a quality sleep. So, sleep hygiene is basically setting your bedtime, which is mentally preparing yourself to sleep at that time, and then also preparing for the wake up time, which is setting an alarm to wake up at 5 or 6, whatever time that you prefer. So basically 8 hours of sleep, setting it at the wake up time, as well as setting a sleep time, which is very important these days because most of us, we sit on the phone scrolling the reels and we do not sleep on the time that we plan to sleep. So what is more important here is no screen time. So we call it dark time. So if you've decided to sleep, you should not be using your gadgets or any light in your eyes shouldn't be there for at least 30 minutes before you sleep. And the next thing and the very important thing is eating habits. So make sure you don't eat at least 2 hours before you're sleeping. The reason why I'm emphasizing on this is the late night eating culture which is increasing in our city these days, which is extremely harmful to have a good quality sleep or to have a good quality life as well. So these are very important things to follow to have a proper good sleep hygiene. Sleep has basically 4 cycles. That is, it has a REM phase and a non-REM phase. Non-REM phase is 3 stages of sleep and REM is 1 phase. So when we're trying to sleep, the first phase, that is N1, is when you close your eyes. The second phase, N2, is where your muscles get relaxed. And the third phase, N3, is where you try to get into a deeper state of sleep. And then comes the REM phase, is where you get vivid dreams, you get dreams and all of that. So one has to follow the whole N1, N2, N3 and the REM phase. So when you pass through all these 4 stages of sleep, you get to have a good quality of sleep and you will feel like you're refreshed. You feel like you've slept for 8 hours. So ensure that you have a good quality sleep, an 8-hour sleep. Do follow the sleep hygiene. So if you have conditions like snoring, daytime sleepiness, difficulty in falling asleep, please do consult your doctor to check yourself.